I am Dr. Rajat Mahajan, consultant spine surgeon at Indian Spinal Injury Center. I am a trained spine surgeon and I have working at Indian Spinal Injury Center for the last 10 years. My work involves primarily the spine work, which includes the degenerative work as well as the spine deformity work. Disc prolapse is a condition in which our disc slips back and it starts to press on one of our nerves. These nerves, they go from our back down into our legs. So the patient with a disc prolapse will have a pain which radiates or starts from the buttock and goes down into the leg. This pain can be very severe and it can be sometimes associated with numbness in the leg, thigh or foot. Most of the times when the patient will extend his leg or whenever he will make his leg straight, this pain will worsen. And whenever he flexes or he keeps his leg he presses his leg to the thigh, this pain might get relieved. The treatment of the disc prolapse is mostly done by medications, or sometimes an injection might be required in the back, which is also called as a nerve root block. In some of scenarios, the surgery might also be required in around 10 to 15% of the patients. Surgery is also required in those patients who develop any weakness in the foot muscles, or sometimes, very rarely, disc prolapse can also be associated with bladder or bowel complications. Then in those patients also the surgery might be required. But most of these patients can be treated by conservative means. That means by medications or injections. The surgeon will order an MRI whenever you go to the surgeon. The surgeon will order an MRI to look for a disc prolapse or a herniated disc. The herniated disc or disc prolapse, it cannot be seen on a normal X-rays. So on MRI, most of these disc prolapse usually occur at L4-5 or L5-S1. For a lumbar disc prolapse is usually a microscopic discectomy or an endoscopic discectomy. It is mostly a daycare procedure or maximum a stay of 1 day is required. Most of the patients can walk next day and can go home. Thank you.